Well, if you have allergies, no one needs to tell you that this time of year is just uncomfortable. But are you sure that's what you really have? In the beginning, COVID was compared to the flu with symptoms like chills and high fever and chest pain.
With Omicron and some of the newer strains, COVID has become a much milder illness, so that now you're seeing symptoms that more closely overlap either a common cold or even seasonal allergies.
Dr. Frank Condesessa is an internist.
Obviously, in the setting of COVID, anytime you're not feeling 100%, you're going to be fearful of COVID.
When you have allergies, you almost always have itchy eyes, sneezing, and that awful postnasal drip. But symptoms of both allergies and COVID can now include runny nose, sore throat, and a cough. COVID now includes the cold-like symptoms, but also a fever and loss of taste and smell. Doctors say probably the easiest question to ask is, do you get sick every spring?
So if you know you're the kind of person that as soon as the trees bloom in March and April and you start to get allergies and now you have allergy symptoms, well, then chances are it's that. If you've never been an allergy-prone person and now you're having runny nose and postnasal drip and you're feeling kind of lousy, well, then maybe you should be tested for COVID. Another
point about allergies, according to Dr. Stephen Thacker from Memorial Health, is do you feel better when taking the normal medications?
For, true seasonal allergies, if you're responding well to, the things we use to treat seasonal allergies, whether it be inhaled sprays in the nose or pills that we take like Allegra or Claritin, that are over the counter, those should be giving you some indication that it's likely allergy that's improving and not COVID-19.
Allergies are miserable, but it's not something you can spread. So be aware of all of your symptoms. Remember, if the over-counter medications you normally take for allergies are working, that's what you probably have. But if you do have a fever or you lose your sense of taste and smell, might be a good idea to see your doctor. Joanne Merrigan, WSAV News 3, on your side.